You're listening to Gender, a Wider Lens.
I'm Stella O'Malley, a psychotherapist in Ireland.
And I'm Sasha Ayad, an adolescent therapist in the United States. Since 2016, my practice has been exclusively dedicated to gender-questioning teens and families impacted by gender dysphoria.
I also work with gender-questioning teenagers, and I facilitated support meetings for families and individuals who've been impacted by gender issues.
We're curious about the concept of gender and how it's unfolding in the wider culture.
Join us as we look at gender through a wider lens.
Susan Bradley is Professor Emerita at the University of Toronto. She graduated with her medical degree in 1966 and completed her residency in psychiatry at the University of Toronto from 1968 to 1972. In 1975, she became the founder of the Gender Identity Clinic for Children and Adolescents at the Clarke Institute of Psychiatry. In 1985, Dr. Bradley handed over the head position to Dr. Ken Zucker, who we interviewed in episode 59. She co-authored or authored over 50 articles on various forms of psychopathology, including gender identity disorders in children and adolescents. After stepping down as the Psychiatry-in-Chief at the HSC, she spent almost 20 years consulting to the children's mental health agencies around the Greater Toronto Area, with a special interest in children with Autism Spectrum Disorder who are high-functioning. Dr. Bradley retired in 2010. This conversation was an incredible opportunity to hear Susan give her extremely informed, long-term perspective on gender nonconforming children and their treatment. She describes what she calls the naivety of early clinicians who put too much trust in the endocrinologist's eager but scientifically weak recommendations. Looking back, she worries that puberty blockers were just facilitating transition, and she wonders if many of the dysphoric children that her clinic saw actually had undiagnosed high-functioning autism. We discuss the cognitive rigidity associated with autism, as well as the laser-like focus some young people have when they're seeking medical transition. She also shares her thoughts on the new population of ROGD kids and describes the cult-like aspects of social media transactivism. Dr. Bradley was honest, incredibly knowledgeable, and this conversation gives us all much food for thought. Here's our discussion with Dr. Susan Bradley. Hello, Stella.
Hello, Sasha. How are you?
I am great. I am so thrilled to announce perhaps the pioneer of pioneers, Dr. Susan Bradley. She's been in the field far longer than anyone else we'd interviewed. She was actually a mentor to Dr. Ken Zucker, who we spoke to several weeks back. So, Susan, we are so grateful to have you on the program. Welcome.
Thank you.
So where do we begin? You tell us, Susan, where do you think we should begin?
Well, I'm happy to discuss the founding of the clinic and sort of what we did in those days, if that's sensible. I don't want to go on too long because it may not be relevant, but
well, we've a lot to cover, but it's really interesting to hear the beginning and to hear the arc.
Okay, and you can edit this, I presume.
Yes.
When I first had just finished my psychiatric training, I had a position at the then Clarke Institute of Psychiatry and was assigned a team of 2 social workers and myself. And around that time, the head of the Adult Gender Identity Clinic sent a notice to our chief saying, we think there should be some effort to work with children who have gender identity disorder, because getting people when they are adults, which is what they were dealing with, may be later than is optimal. And I did not have a particular interest in this. Just
curious to interrupt you here,
Sure.
Susan. It may not be optimal for aesthetic purposes, or for what reason might it not be optimal?
I think at that point they were thinking we could actually prevent it. I think that's what prevent them needing to transition if we saw them as children. I think that was their thinking.
What sort of what sort of year was that?
And that was 1975.
Okay, so back then, people were actually trying to prevent the need for transition,
yes,
or at least that's what they thought at the time.
Okay,
continue on. Sorry for the interruption. Okay.
when I was in my residency, I had found myself seeing I think at the point she arrived, she was 16, who came in saying she wants to be a man. And I had never seen anybody with this difficulty before, but we began meeting, and I, over a period of time, helped her in the transition to surgery and all of the things that she had to go through. And I have followed that person, who is now got to be in her 60s. And he was able to marry the woman that he had been best friends with as a teen, who had had 2 failed relationships but ended up with 2 children. And my patient at that point, I don't think ever considered just being gay or being lesbian and engaging in that kind of relationship with his now wife, who's now deceased. But they got married. He transitioned and has had a reasonably successful life with his partner and her 2 children. She died a couple of years ago after their one son died, and my former patient, really had a very tough time with that. And he had never gone through phalloplasty earlier, and he decided at that point that he needed to have a phalloplasty. And I found myself again signing papers for the surgical stuff, and he has gone through all of this and continued to let me know how he's doing. We exchange greetings regularly. So it turned out for me to be a very interesting situation, and I couldn't necessarily say that he was the reason our team decided to take this on, but I know that the 2 social workers were more interested in it because it was novel, I think, at that point. And so we ended up being the gender identity clinic for the Clarke Institute at that point. And I had the good fortune of having 3 grad students, they were postdocs at that point, psychology, come and work on our team. And they all contributed very significantly to what we were doing. And so it was not at all difficult when Ken Zucker indicated that he wanted to stay on in this area, because he had already become very invested in the research connected with it, and I knew that he had those skills that I didn't have. So he really took this on seriously and made his career out of it. And I honestly believe he's the best academic researcher in this area in the world. He might not claim that title, but I really think that there's nobody with his list of publications. But just getting back to the kids that we began to see, we didn't have any kind of framework to understand these kids. And although we recognized that they weren't really typical, we didn't know what to call them. And I ended up calling them borderline personality disorder, if you can believe that. Partly because I could see times when they were really almost dissociating. It was some of the things that they would do struck me as really quite unusual and there was no framework because I didn't know anything about high-functioning autism at that point. And so we continued to try to work with them and their families, and the families really had difficulties in terms of managing that child. And now that I've gotten into this area of high-functioning autism, I've become very concerned. My daughter and I have written a book. We still haven't got it accepted for publication. Really a guide for parents with these kids, because oftentimes they're labeled in many different ways. Hard to manage is probably the most obvious one, but they have these periods of dysregulation which cause a lot of parents to get angry and frustrated and don't know what to do. Oftentimes they see it as purposeful behavior. They don't understand the sensitivity of these kids. And so
can I just ask could I just ask one thing just while you're on that subject? You said earlier that you kind of, in your mind, almost labelled them as borderline. Are you now saying that they were high-functioning autistic?
Yes, yeah.
Is that Yeah, sorry, I just wanted to be clear and make sure the listeners knew that that's where you're coming from.
Well, and there is there's literature out there of a lot of people who are beginning to say, we think the borderline personality disorder is actually the adults who are high-functioning autism. And I agree. The more I sort of put two and two together, the more I decided, yeah, that does make sense. And but that was my learning as we were going on. It wasn't, I honestly didn't feel I knew very much about all of this, but we muddled along. And Ken was so instrumental in doing all kinds of testing of the population. So we had reams and reams of data that really informed us about, how do these parents look compared with parents of other children, other clinical populations. Then they looked more like parents of other clinical populations than they did like the normal population. And some of that may be that some of the parents were also high-functioning autism, because these things do tend to be genetically moderated. But the thing that we ended up doing mostly was this business of watchful waiting, which you mentioned when we were talking about the social transition. We knew that these kids were prone to getting stuck on ideas. And I'm going to give you an example that Ken has used and got awful criticism for it, but it's a real thing. Every once in a while we would hear of kids who thought they were a dog or a cat or somebody or other like that. And as you mentioned in that one audio you were doing, that parents would not think twice about saying you can't be a dog or a cat. But it's very different when they say, I want to be a girl or I want to be somebody else. But I'm giving you that example because we did see a lot of kids who had these funny ideas, and we didn't necessarily put a label on that other than my confused borderline personality disorder. But we were, most of the staff, and a lot of the treatment was actually done by all of the psychology interns that we had with us. We were very fortunate in always having a good collection, and most of them actually stayed after their doctorates were done, not with us, but around at either Sick Kids or the Clarke. And it allowed Ken to collect all of this data that he has since, rigorously analyzed over time and given us this picture of the population with their difficulties. we, in our naivety, I can say, did find certain themes when we were seeing these kids, which we thought were relevant. With the girls, there was a rather consistent story that they felt you couldn't be strong as a girl, that they felt their mothers were not able to stand up to their fathers. And in fact, there had been some of the situations where there had been outright conflict, and the kids saw it and decided that, I'm not going to be female like my mother. And that seemed to be not uncommon. And I saw that in several adolescents whom I'd seen, that they had actually been sexually assaulted or abused. And then subsequently they decided there's no way I'm going to let anybody see me as a female that they can do something to. And excuse me. These kinds of themes seemed relevant. And I mean, when they were seen in therapy, we obviously would work around some of those things if it was relevant. And the parents, I think for the most part, were thoughtful enough that they did try quite hard to understand their child and be more supportive of them without accepting the notion that they were going to necessarily move on as they thought they were going to. And this gets into the social transition thing. So the majority of them felt, with our support, that they really should not encourage the behaviors. They didn't have to really discourage them, but they shouldn't really encourage them, which is, for me, this fine line when you're doing the social transition thing. We worked reasonably hard on getting the kids to have peer relationships with same-sex peers as one way of trying to give them more of a sense of how to relate to other kids successfully. It's noted, I guess, in our book that you've probably seen, that we felt that a lot of the parents had difficulty, at least initially, validating the child. And again, I get back to the complexity of raising a child in this high-functioning spectrum. When they get dysregulated, unless you know where that's coming from, it's very hard for those parents to react to that in what we would consider was an appropriate kind of way. So we were able to support them. I guess that's really what I'm getting at. And to help the child try to think of other ways of being a little boy, or just because you like that doesn't mean you can't be a little boy. The kinds of things you mentioned a little bit in the, excuse me, this is my GERD. It's awful at times. When you talked about the non-binary stuff, that, helping them see that boys can be boys in a whole bunch of different ways. Girls can be girls in a whole bunch of different ways. You don't have to be the standard version of whoever thought of boys or girls as having to behave. So there was a sort of loose kind of acceptance, validation, but not necessarily encouragement of those behaviors. I have a story to tell you. I don't want to bore you, but we were following this young man who had been in childcare when he was younger. He'd had a very tough early childhood, and he would come in at least once a year. We would do a follow-up on him, and he continued to look to us as though he was on track to transitioning. And after I'd finished working at the Clarke, one of the agencies up here where I was working is where he was, and he was in a group for GLBT kids, and he, I would get feedback from the people helping him and working with him, that he was okay, but everybody assumed he was going to transition. And one day he came, I was entering the building, he came, and he was coming out, and I looked at him, I said, geez, you're looking great. I said, I don't need to be trans anymore. And I looked at him. What had happened is, in the group that was run, organized for gay and lesbian kids, he had met a gay boy, and they fell in love. And the acceptance that he felt in that relationship was all he needed for him to say, I don't need this. And, it was those kinds of early experiences that made me think there is so much malleability here, and we got to work with it and give kids the opportunity to make a decision. Now, that doesn't mean that we had some kids who went on, and certainly we were doing puberty blockers right after the Dutch got doing it. We started doing it, and I remember very much being somewhat concerned that we were facilitating the idea of transition, that we were back to the social transition kind of notion and encouraging it.
Could I ask you what year was that you were doing the puberty blockers?
Oh, it must have been the early 2000s. Yeah, around there. And we went through all sorts of hoops about is this really reversible, and what's going to happen. And the endocrinologists were fairly encouraging, saying no, it's okay. And we, not being well educated, accepted that, and obviously the literature since then would suggest that that's not very simple. But and what does discourage me is now when I see the literature about if kids go on puberty blockers, they're pretty sure going to go on cross-sex hormones and so on. That stream has just solidified in me that we thought we were helping them, buying time, but we obviously were probably making it worse. However, the processes were not, in my mind, particularly sophisticated. We were doing the normal, help the parents in the relationship with their child, don't make it worse, allow them to think about things and proceed. And with the follow-ups study that Davida Singh did of the 100 boys in our sample, the majority of them, I think we were up to 90%, did not transition by the time they were late teens. And I think that because we weren't promoting social transition, because we were being pretty laid back about, how you can be a boy or how you can be a girl, it didn't promote something until we got doing the puberty blockers, and then I think we were into a different kettle of fish. So,
may I ask, you talked about your first patient, the 16-year-old girl, before you had opened the gender identity clinic.
Yeah.
Knowing what you learned in the following years, do you feel like you would have done anything differently with that patient had you gotten a kind of do-over?
If I had had access to a gay and lesbian support group for teens, I would have asked her to go to a gay and lesbian support group. And, I've talked to some lesbian friends of mine, and they've said, we haven't exactly thought that, we could do much about this. But I think there are opportunities for these people to emerge as gay and lesbian, and that to me would be absolutely perfect. But you can't say that's what you ought to do. but you have to give them the opportunity to find that somebody loves them, I guess is the only way I can put it. Somebody will validate them for who they are. They don't have to be somebody different. That's, I think, what I would have tried to do if I'd had access to that.
I think that's lovely, and we spoke to Stephen Levine, and he spoke very eloquently about love and the power of love and the power of the human connection, which kind of pretty much falls in with where you're going, and falls in very much where I think myself and Sasha go as well. I think it's underestimated. Love as a healer. It's certainly been a healer in my life to an extraordinary degree. I always wonder, and maybe you can answer this, we are well aware that, okay, a certain section of these children grow up to be gay. We're pretty sure of that. We're also very aware that there's a very high rate of autism among these children. Is there a defining theme or pattern among the children who grow up and transition? Is there a defining theme on those children, if you follow me, rather than, let's say, the children who desist?
You know, when I was listening to your thing on social transitioning and some of the ways you were trying to pull it apart, in terms of what does it do for them, and for some of them, it is a solution to their mental distress. And, you know, for these kids who are cognitively somewhat rigid, finding a solution, you know, somebody who said, oh, yes, you know, you must be, that answer has got to be very freeing in terms of self-validation. And so my sense is that there are people who go through the transition who do get that out of being, of the transition, and are happy enough. This person that I spoke with you about, I don't think he's had any regrets whatsoever. But, you know, we're going back. I would probably have had difficulty trying to convince him that being lesbian was a reasonable outcome at that point, because socially it was not very acceptable. You know, this is way back in the 1970s, early 70s. And so some of these people feel they don't have any other solution. And if they can make it a solution, that they can find somebody who validates them. This man that I'm referring to, really, in his relationship with his wife, felt very validated. She had been in 2 failed relationships before they hooked up in their relationship, and he was just one of the nicest guys you could ever meet. So I think that, you know, it becomes, what do you do with it? And when I've talked to some of the sisters or seen some of the stuff on the internet, you can see that some of them make their way out when they find a lesbian. I'm talking mostly about the females, a lesbian relationship that works for them. But I think some people can find something in the transition where somebody accepts them for who they are. And I think that's going to work. But I think there has to be something like that to make it work, is my view.
We hope you're enjoying this episode of our podcast. We work very hard to maintain high-quality content for this show, and we're grateful to RIME and GenSpect for supporting us.
RIME, or Rethink Identity Medicine Ethics, is a non-profit organisation dedicated to improving long-term care for gender-variant individuals. Visit rethinkime.org to learn more.
And GenSpect is an international alliance of parents and professional groups whose aim is to advocate for parents of gender-questioning children and young people.
If you'd like to become a patron, you'll have access to weekly transcripts and special Q&As, and you can join our listener community.
Now back to the show. Susan, you also talked about cognitive rigidity, and you've alluded to high-functioning autism in several places, and I'm thinking about a conversation we had recently with British psychotherapist Az Hakim, and he used to run these therapy groups for individuals pre-transition and post-transition. And he observed that the more cognitive rigidity and autistic traits a person has, the more content sometimes they were with the transition because it kind of gave them that direct, concrete solution. And I've heard you speak in another interview with Dr. Deborah So about high-functioning autism, and I'm wondering if we could just spend some time. Can you describe what you mean by that? And, in my work, as I was sharing with you earlier, I realized more and more and more that a huge percentage of the kids I work with have these traits that are very easy to miss unless you have a highly discerning eye and really know what you're looking for. And you said, you used to label these kids borderline, and now you think they had high functioning autism. So what are those traits that you were observing?
Well, if you go back and get a childhood history, nearly all of the kids show some evidence of extreme sensitivity, often to physical things, but also to things that don't go the way they expected it. And that tends to lead to meltdowns of different kinds. Now, you don't see the physical meltdowns in the kids as they get into being teenagers, but they're having the dysregulation and manifesting it in anxiety and depression and other kinds of psychopathology. So it's their extreme difficulty re-regulating themselves when they get distressed about something. And one of the things that for me was different about the anxiety or the depression or the suicidality is that it wasn't typically a prolonged kind of preoccupation. It often occurred following some incident or insult or something that they were upset about, and they would react to that with their dysregulation and get suicidal thinking. And oftentimes we would admit some of these kids to hospital only to find that, within a day we had them back out again, because it wasn't the prolonged preoccupation that you often see with people who are suicidal or seriously depressed for other reasons. There's a reactivity about it that comes from this problem with self-regulation. The other components, we've mentioned the cognitive rigidity, and they really can get stuck on believing that if they have thought of something that makes sense to them, regardless of whether it makes sense to other people, they're right and the other people are wrong. And it can be very hard for them to let go of that. And that's where, the idea of finding a solution gets reinforced by the cognitive rigidity, because they glom onto that in a way that really keeps them safe. And I think this controlling kind of bit, like people will talk about them as they become older as sometimes very controlling. And a lot of it is that they get very uncomfortable if they don't have control. So that's partly their way of managing their dysregulation. They don't know what to do if somebody really corrects them or says, no, you're not right, or anything like that. They can't tolerate that very well. And, the obvious other things is they really don't read other people well, and they will do and say things that are really not appropriate. They can often get into wanting to get back at people for things. And, some of these kids, we're talking about the kids with gender identity disorders, but I actually have seen some kids who have these traits who are at some risk to getting into serious behaviors around getting at people. And if you look at some of the people who've done serious things like the van attack in Toronto, I don't know whether you've any familiarity with that. That man was labeled as high-functioning autism. And the person who did the Sandy Hook murders was also labeled as Asperger's. So some of these traits go one way, some of them go another way. Some of them get depressed, some of them get angry. But my strategy was always to go back and ask, well, tell me, what were they like as children? How were they in primary school? Because most of these kids had difficulty maintaining friendships. And that's because they didn't really get the give and take of a friendship. Like they didn't, and they oftentimes struggled with group efforts. Like they were also bright. A lot of them were very, very bright. And when schools would emphasize this is a group project, they would get very fed up with the other kids who didn't know what they were doing or didn't participate, and they didn't like group work at all. So they would go off and do it themselves. There were a lot of these kind of definers that if you look closely enough at it, you could see what was going on. And, the others, some of them even had some very typically autistic things that you could see if you asked about it. Some of them continued to do things like toe walking even when they were getting older. A lot of them got quite obsessed and into repetitive activities. They could tell you everything you never wanted to know about something or other. But you had to ask about those things. That was the way, because nobody came and told you, this is what I'm like. And in fact, they didn't really want to acknowledge a lot of that stuff. So,
Susan, I wanted to ask about another thing that I've observed and just kind of get your thoughts on it. I think, too, sometimes, especially in the contemporary kind of adolescent onset gender dysphoria population, I meet a lot of kids who have a very hard time interpreting social dynamics and therefore have a really hard time understanding themselves. And so they're almost constantly analyzing and referencing what is one supposed to do in this situation. And it's a really big challenge with figuring out who I am. And when you have kids who are also using the social media influences and information to try and figure out who they are, they almost become so porous that they will adopt any kind of identity from outside and have a very hard time grounding themselves in a stable identity, which to me reminds me a bit of the borderline traits that you first described. I'm wondering if your work encountered kids like this, because these are not necessarily kids who are assertive or aggressive. These are kids actually who are cowering in a corner, blowing like a leaf in the wind.
I think that's bang on, and particularly of the girls. They have struggled. Nearly all of them have felt that they didn't fit in public school or elementary school. And then when they get into all of the social complexities of being a teen and going through puberty and the social stuff that goes on between young teens now, to me, is excruciating. And I would have had trouble with a lot of it. And I heard Stella talking about what she did the other day. And I thought, a lot of people who are just kind of straight shooters can't get into some of the complexities of who's who and who likes who and, all of that stuff. And the majority of these kids are immature, like their interests. I've had so many of them, they're almost still playing Barbie dolls when they're 12 and 13. I mean, that's an exaggeration, but they don't know how to get in, and they try a lot of things. They hang back on the fringes. They hope that somebody will be their friend, but and then they get hurt really easily because they may try to be a friend to somebody, and then that person sort of moves away from them, and they're just devastated. And that's the kind of climate that they're struggling with, and they don't know what to do. And so when they meet all this stuff on the internet, if you question who you are, because they do question, is it me or is it them? What's happening? What am I doing that's not right? And somebody says, well, you must be trans. Well, what does that mean? It's, again, a solution that makes sense and allows them, somebody thinks I'm okay. And that's a very powerful thing for them, struggling with all of that teenage stuff, which is really powerful.
So you started to make these observations and piece things together. And you said earlier, we were somewhat naive in the way we were analyzing these cases. So I guess kind of take it from there, like what happened? You started to introduce puberty blockers and you wondered about whether or not that was a facilitation of transition, and then kind of like keep going with that chronology.
Well, we continued to do it, and partly because the Dutch group were doing it. We had a lot of connections with them about it and discussed all of these things. But, it wasn't until everything sort of blew up with the trans activists that people actually started looking at puberty blockers and if you start on them, you're going to stay on them and you're going to transition more easily. That was just the kind of information that I thought, it confirmed my worst worries. The other part of it too was that people and the trans people were using this, and I think not, and the affirmative approach people were using it, that these kids are all suicidal and we're going to stop them being suicidal. Well, we then started to get follow-up data that even those people who transitioned were still suicidal. And so a lot of the longer-term outcome, there's still individuals who have autism spectrum disorder, and if you look at that population, suicidality is right there, right at the top. And you don't take that away by transitioning or anything else. So I really have begun to put this together in my head as a result of what these kids have been going through and the data that has emerged. And now, with the worry about puberty blockers, not only in terms of the long-term effects, but possibly also the shorter-term effects on their sterility and a lot of things like that we were not really in the know about. We were too trusting. And this is medicine and how it evolves. So
could I ask, the puberty blockers, so you must have been tracking them if it started in the early noughties. Did you notice a lack of maturity when they didn't go through puberty? Not body maturity, kind of emotional and cognitive maturity, if they took puberty blockers?
I can't answer that, Stella, in part because I didn't do the follow-up of the teens. So somebody like Davida or Ken would have been more on top of that data than I was. I wasn't right in the clinic when we were, following these kids up. We would have started it, but not had enough, I guess, awareness to see anything that was really dramatically different. But I think it's a reasonable question.
Yeah, it's always sticking in my mind and also the out of sync of these children. And we saw it so well with Jazz Jennings as she started to grow up, and all her friends were starting to naturally they became obsessed with boys. I remember it myself, and she just wasn't. And she wanted to go back to, from what I could see, she very strongly seems to want to go back to, we're just friends and we're not obsessed with boys. And, and it looked to me like she felt very out of sync with them because she just didn't have the raging hormones that was making them become absorbed in boyhood. And by the way, Susan, I did hear you on the Jazz Jennings programme. I was very excited because I was watching it. I've just been watching the entire series recently. And they started talking about how there was an expert coming on the radio and Jazz Jennings was there. And who was it but you who came on to tell them that it was 80% of the children would grow out of it and that they could be gay and stuff. It was a great contribution you made to that programme.
Well, they got rid of me very quickly. I don't know whether you saw the end of it. They said, we've had enough of that talk.
They did, but you landed it because you made the point and you could see the shock in their faces. And then they quickly said, that's junk science. But I thought it was really powerful. You just came on and just said the facts without any agenda, just like, this is the data. And it was very powerful. For me, it was a very powerful part of the series.
Stella, to go back to your question about maturity, though, I think, these kids are immature. And so puberty for them, I think, is a very different experience than it may be for kids who are more socially sophisticated and mature. So whether or not putting them on puberty blockers makes them more immature, I think it would be hard to answer that question, like to do the kind of follow-up about it because of their basic immaturity that we're starting with.
When did you first see the social transition coming in as a serious and common treatment option? When did you notice the kind of the arc of social transition? Because it seems to be now, like even in Ireland, it's huge.
I think that was Jazz Jennings, honestly, because prior to that, everybody was very cautious about that kind of thing. And, this is where the trans lobbyists have been very successful in taking over something and using it to move their agenda along. Unfortunately, in my view, with little regard for the people who are being impacted, but I think that's what's happened.
So, Susan, just to help me with the timeline, at what year approximately did you leave the world of working with gender identity?
I think it was about 2010, somewhere in that. It was just before Ken got ousted. I think that's around the time, yeah.
So that's right before the kind of boom that we see when you look at the graphs of the numbers. They just kind of spike up so high around 2012, 2013, 2014. So I'm sure you've been kind of watching all of this happen. What do you think about this unbelievable change? Not only the sex ratio reversal, but the astronomical numbers of teenage girls skyrocketing.
I think this wouldn't have happened if we didn't have social media, in my view. It's that conjunction of widespread access to social media so that somebody can look something up, get an answer, and then find a support group. And we didn't have that before. And I think that's what's really got it going. But, once it started, I don't know whether you have any recollection of some of the earlier cults, the Jones cult, and there were a number of cults in North America that really pulled vulnerable people in and, eventually killed them in the Jones cult. But, it feels like a cult to me. We will be your best friend forever if you transition and become one of us. And that's the way it seems to work. And they're desperately in need of that kind of support. People who validate them and think they're good. And I think as therapists, the challenge is to find other ways to help them feel validated in relationships. And, initially with their parents, you both talked about your experience working with parents. And if parents can learn to validate them and not overreact to some of those kinds of things, I think that's a start. But they've got to get peer validation. I think that's really critical.
I'm often telling parents, I would suspect, of course there's no formula, but I often say I would suspect that if your kid developed really fun, healthy, enriching peer relationships with a group of kids that wasn't obsessed with gender, you'd see a lot of this fade into the background. And so I really resonate with what you're saying. You said, Susan, that it's important for parents to validate their children in other ways. Can you expand on what you mean by that?
Well, these kids, like all kids, need to feel that certainly as they're growing up, their parents are understanding them, supporting them, loving them. And I know that most parents say they do that, but it can be very hard with the behaviors of some of these kids for parents to know what to do and how to do it and not get frustrated and angry. I have, over my career, had experience with certain situations where some of these kids have been able, one of the colleagues that I worked with for years, her daughter was clearly high functioning in the autism spectrum, but she never really put a label on it. She was gifted, and she got in to gifted programs, and the gifted group hung out, and they validated each other, and that was the glue that they needed to say, I don't care about somebody else. This is my group. And that's what kids need. And if these kids can find some opportunity like that, I think we've got a much better chance. We as adults can't do that for them. That's part of the problem. They do need to have something that they can do with peers that makes them, okay, he's a good person or she's a good person. We're great. We played a lot of tennis when we were younger, and I'm always watching tennis. And some of these young athletes have some of those traits. I swear to you, if I could do but having some of those traits is what has allowed them to work as hard as they do and get to where they are. And so you can see that there are real strengths in this if we can validate the strengths and get them doing something that's good for them. And that's the challenge.
I think that's such a good point about sports people. I like sports too, and I agree with you. A high level sports person needs such focus. It's such an unhealthy life, frankly, because it's just you burn everything for the sake of that sport, what you will do for a swimmer or a tennis player. And also, I've often made in my own mind an analogy of, transitioning is almost like the child going to, in Ireland, like soccer would be big. It's like sending the child off at 10 to a kind of a high-level professional soccer club, and they go and live and they do soccer for the rest of their life, and that's all they are. They're soccer. That's their identity. And my God, if it works out, they will be phenomenal. But if it doesn't,
make a lot
there
of
will
money.
be very little left. They'll make a lot of money. But did you ever read Andre Agassi's book? He's the tennis star.
Yeah.
Agassi, I always say his name wrong. Andre Agassi.
I was thinking of the runner. I've read Agassi's book, and
Wow.
And
he was bred to become that tennis player, as were the Williams sisters. But what happened was when tennis was taken away from him, there was nothing left. His identity was zero. It was empty. And that's what's frightening, I think, for anybody who who transitions or seeks to transition, they cling on to that identity. There is nothing. It's like the ballet dancer. There is nothing without that identity. And it's a big gamble.
Yeah. You look at Sisyphus. I don't know whether you follow that, but he has some of the oddest mannerisms. He would start beating his head with his racket and doing stuff like that. Oh, okay. Yeah. And Djokovic is pretty weird. All
the tennis players. Well, so I'm going to write them all off. I've diagnosed them all.
Well, but especially,
well, not write them off because they have great strengths, but definitely categorize them. Sorry, go on.
But the young people coming in, Bianca Andreescu, who's one of the Canadian women, at some point she said, I'm 21 years old. I've never done anything that a normal 21-year-old does. This is where there's the strengths of it. If they can be used, we can help these people find something. But not everybody's going to be, a genius or particularly good at everything. But I think we need ways of finding a niche for all of these kids that will make up for what they feel they ain't got.
I'm thinking about, at least in a contemporary landscape, a lot of the kids you're talking about, the gifted kids, the really bright kids, the kids who have a special interest, if you go to some of the places where those kids hang out, you find that a lot of them are trans-identified or they identify as non-binary. So I think it's really tough for parents because a lot of the parents I work with, I have a feeling they might be different from the parents you encountered early on in your work, Susan, but these are families who are incredibly validating of their children, and they're actually afraid to upset their children sometimes, and they are bending over backwards looking for drama and theater clubs and art groups, and they can't find a place where there are going to be other kids who aren't also fascinated by gender, because there's, I think, an intellectual curiosity that these smart kids have about all the labels and the definitions and the cool flags. Like, it's very catchy. So it's a challenge, I think, for parents to find those spaces to validate their children's strengths.
I think you're right, and this is part of the change, the shift over time, that because the trans kids will have, occupied spaces like that, and so you can't just find a normal gifted program without kids who there may be more in that program than would have been before. I think it's inevitable.
I wonder a little bit about we know there's a combination. Let's say if they're gay, and if they're gay and autistic, they're immediately much, much more likely, if you follow me. But is there many children who are, let's say, like myself, bringing it straight back to myself, who was neither gay nor autistic? Is that why I grew out of it, I often wonder? Because I always thought it was like, had I been, I had gender issues as a child, and I was very intense about them. And had I been lesbian, I think it would have that would have been it. I don't know where my brain would have gone. And had I been autistic, presumably it's the same. And it's like, I wonder if there's many children who are just either not autistic or not gay who transition. I wonder, is there any? I'd go so far as, you know what I mean? How many is there? Is it a tiny number?
I can't answer that, because I think what has happened now is certainly different than what we were seeing 20 years ago. That because of the, I call it an epidemic. If you look at Lisa Littman's stuff, where in one class you've got 3 or 4 other kids who are all saying, yeah, I'm trans too, that doesn't make sense. And so if you have a difficulty with your conviction of your goodness and your belief in yourself and all of that stuff, you probably are more safe in terms of having to get into these kinds of things. If you're lacking that, and many of us have trouble, with having that kind of conviction, you're vulnerable. Whether you don't have to be autistic or gay to to do that, but
could I Yeah, you're more vulnerable. There's something I'm dying to ask you, because it's a bit of a debate that's raging in Ireland and England, which is some people argue that there shouldn't be gender clinics, that it's too specific, and that it's almost, it's negating all the other aspects of the human, if you follow me, and they'd be better off in a larger, kind of a larger setting. And some people argue very vociferously that there should be, because it makes it a more specialist. I know you've worked within this so far, and I know you'd have a kind of a very long-term perspective. Where do you come down on that now? Now that it's all changed, if you follow me, now that the numbers are skyrocketing?
You know, I think we have to have gender clinics that have a more nuanced understanding of where these kids are coming from, and who don't just accept, you must, if you even think you're trans, you must be trans, which is that ladder that they get on and can't get off. To me, they still can benefit. I mean, you people as therapists know that these people need support of some description. My problem is the kind of approach with the affirmative approach is just not a sensible approach. It's way too quick. It doesn't give people time to grow and think and consider options. And that's what we need in our clinic. But I wouldn't do away with a clinic, but it would be a lot different than it is right now.
That's such good advice, and that's so wise. And I hope that as we try to grapple with the changing population, that is a nuanced perspective that more clinics will adopt to become, better suited care for these kids. So I think we're at the end of our time, but it's been so great to have you on, Susan, and we're really grateful for all of the wisdom and experience you brought to our discussion today.
Great. Well, I value what you're doing, so I really want you to keep going at it. It's a hard slog.
Thank you so much. That means a lot, really.
It really does. Thank you.
Good.
Thanks for joining us this week on Gender, A Wider Lens. This podcast is sponsored by Rhyme and GenSpect, and listener support means a lot to us. The best way to help is to subscribe and review us on iTunes.
Follow us on social media, and if you'd like to become a patron, you'll have access to weekly transcripts of the show, special Q&As, and you can join our listener community. Just go to our Linktree, that's linktr.ee/widerlenspod.
Our discussions are for educational purposes only and are not intended as a substitute for mental health services.